Ladies and gentlemen, we are about to be joined by our friend Dr. David Samadi, Chairman of Urology and Chief of Robotic Surgery at Lenox Hill Hospital right here in New York City. He's also viewable, like that, he's also viewable on the Fox News Channel Sunday mornings at 10:30 a.m. Eastern Time on House Calls with other doctors from Fox and also with my friend Eric Shawn. And we're getting a lot to talk to him about. We have stories on prostate surgery, that it helps younger men. It's a Harvard study, and we have a simple new treatment that I want him to weigh in on for an enlarged prostate. They talk about an 8 to 10 second blast of steam delivered to the prostate gland by an instrument similar to a cystoscope, may relieve an enlarged prostate. So, of course, that's one of his fortes. So as soon as we get the thumbs up, we will ask the good doctor about all that. And a story that even slightly elevated blood pressure can lead to stroke. Now, I just read a story where they want to limit the elderly when they give them blood pressure medication. Anyway, let's welcome in Dr. David Samadi. Hey, Doc.
Hey, Steve, how are you?
Good to see you. Feeling better?
Yes, I'm sorry that I missed your program last
That's
Friday.
okay.
We came up with like a worst case of flu, but I'm much better.
Now, wait a minute. Did you take the flu shot?
Yes, I took it. So much for that. Huh?
I rest my case. I will never take the flu shot. Anyway.
All right, I'm going to follow your advice next year, I promise.
I'm not advising anyone in the audience not to take it or to take it. All right. Let me ask you about these two studies on prostate. One, that prostate cancer surgery, it's a Harvard study, helps younger men. That's interesting.
So, first of all, younger men, we're seeing that when they are diagnosed with prostate cancer, they're also being diagnosed with very aggressive prostate cancers. And you have to be quite aggressive in younger guys because they have more than 30 years, 20 years ahead of them. So you want to make sure that you cure them from the cancer. But it seemed that the robotic surgery, as a result of precision, the magnification, using the camera during the operation, were able to do a better operation. And the positive margin, meaning that the chance of cancer being at the edge of the prostate was much less with the robotic surgery compared to open surgery. You see, Steve, in open surgery, we always count on our tactile feedback or touch and feels because we have the abdomen open, we have our hands there, and that was the way to go. But a lot of times this touch and feel can cause more damage and cause damage to the sphincter, to the nerves. So now with robotic surgery, because there's a CO2 gas in the abdomen, there's really no blood, there's no bleeding, and since there's nothing on our way and we can see well, we can do a much better operation. So this was a big news coming this week about robotic surgery.
Yeah, and that the surgery trumps a watch and wait approach, as you said, because these younger men have so much time ahead of them. And let me ask you about this other prostate story about an enlarged prostate, and the way you find out about that is through the digital exam, which every man should get once a year from their GP or internist or whatever. And that's talking about an 8 to 10 second blast of steam delivered to the prostate. How effective is that, and what do you know about that one?
Yeah, so before we go to this enlarged prostate, let me just tell you one other study that was also extremely important this week, which came in the New England Journal of Medicine, and it was comparing surgery versus watchful waiting. This is something that's completely randomized, Steve, meaning that some group, they went for watchful waiting, some went for surgery. They followed them for about 23 years, and they found out that surgery, it has a survival benefit. There was 30% chance of spread or metastases. And this is what we were waiting for a long time. Very important study that showed that surgery has a lot of benefit over watchful waiting. Now, it doesn't mean that you have to take every prostate out. It just means that if you're older and if you have a slow-growing prostate cancer, you can be a little more aggressive, but when you're younger, surgery has advantage. Going back to the question that you were asking about the enlarged prostate, you know, you do the cystoscopy and you see that the prostate is blocking the path of urination. You do the rectal exam, digital rectal exam, and everyone over the age of 45 should get an annual digital rectal exam to find out if there are any lumps or bumps on the prostate. But with this enlarged prostate, there are many ways of taking care of this. There are medications. One of the treatments that you talked about is this thermal therapy, which is burning the prostate. And the one that I prefer is the one that you shave off the prostate and you open up a nice channel and they can urinate much better. It's called button TURP, T-U-R-P. I'm not a big fan of this thermotherapy. It causes a lot of irritative and urgency and lower urinary tract symptoms. So while this study showed some positive findings on that, I personally, as a urologist, I will tell you that it's not a good treatment. I don't offer that to my patients.
I got to tell you,
it's a thermotherapy for the prostate, and it causes a lot of burning, and I'm not a big fan of it.
Well, both of those alternatives are making me cringe just hearing about it.
Yeah.
To be honest with you. Now, how about this crazy story? Maybe it's not so crazy, but it's from the Cincinnati Cancer Center, and even low levels of something called BPA, bisphenol. The chemical in cash register receipts, believe it or not, and many plastic containers can cause cellular changes in prostate cancer tumors and may be a marker of the disease that turns up in men's urine. Now, wow, that's frightening too.
So, I'm glad that this whole show is dedicated to prostate cancer, and you're covering really interesting and exciting topics. This bisphenol A that you're talking about is everywhere. It's in the lining of a lot of cans, so a lot of the tuna fish that we eat. It's in the, when you make one of these popcorns, it's in the lining of the package with the popcorn and the microwave. It's basically in all of these bottled cans, you have BPA. And now even in the cash register, there seems to be a cumulative addition of these BPAs. And over the years, it can actually get into your system, and it changes some of the chromosomes that's responsible for prostate cancer. This is also another big finding. Now, some BPA probably could be safe, but we don't know what kind and how much we're getting as a result of everything that's going on. So it is a big concern. And the advice is that really try to minimize some of these popcorns and minimize using some of these, canned food. It leads to diabetes, it leads to prostate cancer. And I guess when it comes to these kind of registered receipts, that just don't keep it in your wallet, don't keep it around, and use mostly electronic receipts as opposed to these.
And what about, you hear plastic, and, who doesn't these days, too bad I didn't think of it when I was, 25 years old, but who these days doesn't drink bottled water constantly or something in a bottle?
That's true. So be careful, because you can always switch to these glass bottles. And number two, you can also get these plastics that says BPA-free plastics. In fact, when we did this segment about BPA about a month ago, my wife was listening to this segment, and she went out and she converted the entire house to BPA plastics. So there are some solutions, and you can always get, this bottled water as opposed to plastic ones. But again, a lot of it is probably not, you cannot avoid it. You're going to get some of the BPA no matter what. You just want to try to minimize it. So getting rid of your receipts, not using too many plastics or use BPA plastics. You just have to be conscious about this. And I'm not sure why FDA is not really looking into this.
Something else for me to worry about. There you go. Doc, always great to talk to you. We'll watch you on Fox News Channel Sunday morning at 10:30 a.m. Eastern Time on House Call. Say hello to my buddy Eric Sean.
Thank you so much.
And thanks for being with us, sir.
Thank you. You're great.
My pleasure. Thank you. All right, folks. Yeah, that's, you could freak out. You really can. I mean, this plastic phenomenon is relatively new. I mean, when I grew up, I wasn't drinking water out of a plastic bottle every day. Now I'm drinking it multiple times a day. It's and we all are. So it's I have the plastic bottles in the refrigerator. So go find BPA-free plastic, and if you know where to get it, maybe Mrs. Samadi could call me and tell me where to go get it, because I'd like to know. All right, folks, we're coming back with Gimme 5 on the Steve Malzberg Show, Newsmax TV.
The Steve Malzberg Show.